what have they done? Have they done all those 4 things that you mentioned, Patrick? Or have those countries internalised those lessons, or have they done something else? Both of you, either of you.
I think those countries have, to varying degrees, done those things. I mean, I suppose those policy lessons were drawn from the available evidence we could gather on those 7 countries. I mean, obviously there are other factors we didn't touch on. I mean, I think there's some evidence that income inequality is correlated with inequalities in sorts of others. So I think there are wider questions we didn't go into, for example, around asset distribution, income distribution. So I think there's a need for more research. But I think those initial 4 lessons that we drew on were, I think, reasonably well evidenced from those countries.
Okay.
But just to say thanks, like one of the things we've identified, which is not based on empirical analysis but from field experience, is the existence of some cadre of community health workers, people who interface between the static bricks and mortar of a health system and families. A cadre that's able to work with families on nutrition practices, on rehydration and so forth. There are examples, the so-called lady health workers in Pakistan, Ethiopia's greatly expanded cadre of village health workers. These seem to be making a difference.
Okay, great. Now, over to you. Right, who has no question? There's a lady in the front row has no question. I'm trying to remember who has no question. You have no question. You have no question. You've had a question. You have a question. If there's time, I'll come back to you, but I want to take people who haven't had a chance to speak first. Can you tell us who you are, please?
Thank you. Victoria Schul from Restless Development, the Youth-Led Development Agency, and we also coordinate the DFID CSO Youth Working Group here in the UK. So it's kind of starting with a bit of a comment, but young people, including children, are often seen as beneficiaries with needs in development. But Restless Development and Youth Working Group believe that young people are an underutilised resource of initiators and implementers in development, especially for accelerating progress towards the MDGs. I think young people are disproportionately affected by potentially all of the MDGs, most notably around youth unemployment, girls' education, youth pregnancy. So I'd be really interested in hearing the panel's views on this, and particularly in relation to equity.
Okay, great. Is there anybody else over there? Have you had a question? Yep. You've had a question before? No. Okay, I'm saying, had you had a question before? I couldn't remember whether you had or not. I've just asked you whether you had.
No, I haven't. Well, I did lie though. I haven't got a question. I've got 3 quick comments. Is that allowed?
Well, I would like questions really, because there's a limited amount.
Okay. To all the panellists, what do you think about these 3 quick comments?
No. Come on. No, you can talk to the panellists afterwards. There are people who've actually got proper questions. Okay, there's a lady here.
Anna Thomas from ActionAid. Hi, Johnny. Okay, a lot of this discussion is kind of implicitly about aid policy, but there's also increasing debate about the role of governments raising their own revenue to fund development. Incidentally, one of the best ways of improving accountability of government. So I was interested, particularly going back to Claire's presentation, if there's any evidence of countries where progressive taxation policy has helped to increase equity.
Okay, good. There's a gentleman to your right. Left, right.
Thank you. I'm James Georgilakis from IDS. I just wanted to quickly say that Andy Sumner's research, which has been talked about a lot today and is very interesting, about most poor people not living in poor countries. You won't find it on the IDS website quite yet. You will find something about it next week. I promise. His research isn't actually due to be published until the autumn, but we will, of course. It is the autumn. Well, it is the autumn. Later in the autumn. But you will find something up there shortly.
Explanation noted.
My question is, we heard from Bella Bird today that DFID are not currently looking at a rights-based approach, and I wondered if the panellists had any view on whether the UK government can lead on developing an equitable approach to achieving the MDGs without seriously developing their thinking on a rights-based approach to development.
Okay, let's just take those 3 questions first. I've got some questions by email, and we'll take some more. If you can, who wants to take the first question about young people?
Well, that's got to be one of these 2.
Okay.
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 I was going to do the first.
Okay, you do that one.
Yeah.
Or at least
It's probably best if you just deal with one each and we get more questions in rather than everybody dealing with
I
them
think
all.
you should talk about DFID rather than me.
Okay.
I can only agree very strongly, wholeheartedly. As you rightly said, young people and children are the locus or the focus of virtually all the MDGs. They're virtually all about children. Part of a human rights-based approach is to empower children age appropriately and young people as actors in their own development and able to claim their rights themselves. You gave one or two examples. I think prevention and or management of HIV is another one where young people have to be enlisted to take their own decisions and empowered in that. Young people are often parents, particularly in poor societies in the developing world, and we want them, to be supported as parents where they are parents. One other one, none of this is easy, of course. I mean, participation is a very challenging area, supporting youth participation, not one where I think we have all the answers. But one that we're pursuing, just to mention, is we started off a very small program, hopefully it will grow, of supporting children and young people as activists for climate change adaptation in their own societies, being activists in terms of identifying where the vulnerabilities are as a result of climate instability and motivating local and government action on that front.
Okay. Paddy, why don't you take the question about can the UK government lead on equity?
The rights-based approach question.
Yeah.
Okay. I think it's a challenge not just for the UK government. I think it's a challenge for the whole international system, and I think the conversation inevitably will move in the next few years to what comes after the MDGs. And I think one of the challenges is going to be to meld the human rights-based approach to development and the human development-based approach to development. And I think, if we're honest, particularly a lot of child-focused organisations have tended to kind of do their work on two tracks. There's been the Convention on the Rights of the Child track and the MDG track. And we do need to somehow draw the best, I think, from those two frameworks and whatever comes after 2015. Because I think one of the hugely important things that a rights framework gives us is a really explicit framework for accountability. It's very clear about the role of governments as duty bearers and about the agency of people in claiming their rights. So I think there's a kind of inbuilt kind of principle of participation in a rights-based approach that is often lacking from the MDGs. So I think that's a challenge for DFID, but I think it's probably a challenge for Save the Children and UNICEF and others.
Okay. Claire, why don't you do the question about many countries where there's evidence that progressive tax policies have worked?
Yeah, I think interestingly, this is partly a response to an earlier question about examples of countries that had reduced inequality. Those countries that have reduced inequality, and there are some good examples, mainly in Latin America over the last 10 years, are countries that have primarily done that through their own resources. They're middle-income countries, some of whom receive a small amount of aid, but they're essentially countries that, for all intents and purposes, poverty reduction within those countries is funded from domestic resources. So those countries that have reduced poverty have done so, that have reduced inequality, have done so by redistributing income in various different ways internally. I'm not sure whether the tax system in those countries is strictly progressive, in the best way that it could be, but public spending, most of which is raised from tax, is certainly highly progressive, and that's how inequality has been reduced.
Okay, I've got 3 questions that have been sent in, so I'll put these next and then we'll take some more. There's one from Leo Williams of Bond UK. He says, what accountability mechanisms do the panellists recommend that the UK should push for at the MDG summit? Accountability is one of Bella's 5 points. There's one from Fiona Napier of the Open Society Foundations.
Hi, Fiona.
Wouldn't the data and analysis have been more powerful if organisations cooperated and produced a meta-analysis rather than producing different reports which agree with each other? Yeah, I can see some flying pigs out there as well. And there's one from Nolan Quigley of the Leonard Cheshire Disability. Says, disability is nowhere in the goals despite disability being a major factor in poverty. Does the panel think that this oversight will now be corrected, and how? So who wants to take anyone? Claire, you can go first this time since you were last.
Okay, can I do disability then?
Yeah, you do disability.
I think you're absolutely right. Disability is nowhere in the goals. It's been nowhere in this conversation. It's one of those dimensions of inequality which is one of the last for people to come to in the long list, where gender equality tends to be talked about first, then we talk about income, then, you know, so on and so forth. Disability often is at the very end of that list, which, you know, for which I think we should all hold up our hands. I think, for me, one of the big things here is about data, is about making these things visible through just improving what we're counting, how we're counting it, how we're publishing it. And I think, you know, disability, like many other sort of dimensions of inequality, is something that we should try to simply make more visible by the way that we measure development. And that's not the be-all and end-all of, you know, of making policy change, but certainly understanding and making visible what the problem is and defining it in a particular way is, I think, a very important first step towards changing the politics.
Okay. Who's going to take the new era of cooperation and should we do that, Richard?
Well, we'll go for it, I think.
Okay. Go on, Richard.
Well, no, thank you to Fiona. Is Fiona here?
No, I think it's been sent in.
Yeah.
No, it's a very good comment. We are, you know, as a first step, making a bigger push to strengthen our partnership, Save the Children and UNICEF, and I think cooperation on data and analysis is certainly an area that we can move forward on. But it's a very good comment.
Okay, Patrick, what accountability mechanisms would you recommend that the UK should push for?
I think the major challenge between now and 2015 is going to be to press for accountability in the countries that are furthest off track on reaching the goals, and to, you know, accelerate and consolidate the progress that's already been made. And a lot of that is to do with political culture, the political environment in countries, the ability of civil society organisations to hold governments to account for these issues of, you know, lack of progress towards the MDGs, inequality and progress towards the MDGs to become high-profile political issues in their own right. I mean, I think what's disturbing often is that the countries that are furthest off track on MDG 4, child survival is not a major media political issue in those countries. You know, there are very few Kenyans who even know that 200,000 Kenyan children die every year before their 5th birthday. You know, it's not something that makes the pages of the nation on a weekly basis. So I think the whole political culture around the MDGs needs to change in country. A lot of that's to do with structure changes. I think there are things DFID can do. I think that we probably need much more regular check-ins at the global level between now and 2015, an annual check-in, I think a fairly high-profile meeting to gauge progress towards the goals. I think we need more collaboration on data analysis and disaggregated data so that we've got a clearer picture of where the progress is happening, where it's not. And I think there probably needs to be more support to civil society organisations in the south who are best placed to actually act as an accountability check. Okay,
good. There's some more questions now. I'm going to be biased towards equity here by choosing people who haven't had a question before. Who hasn't had a question? You haven't had a question, if you don't think.
Alison from UNICEF UK. Are any, thinking about under 5 child mortality, are any of the panellists aware of any evidence that climate change is driving increases in inequality in countries? Or any thinking on whether we need to think about focusing on the most climate change affected rather than, say, the most conflict affected? Thank you.
Okay, who else has another question? Okay, who has had one question but like another question? Okay, 2 here then. Okay, you've been patient and good, so you're rewarded.
I'd like to ask a question to Mr. Watt. A large proportion of under 5-year-old deaths occur in the first year of life, if not in the neonatal period. And I would be interested to know why safe labor and delivery and neonatal care was not one of the focuses in your report, considering that Ghana has actually looked at that area and had improvements in under 5 mortality.
Okay. Right.
Do I introduce myself again?
No, we know you are.
Patrick and Richard, you were talking about addressing child mortality through healthcare and nutrition services. I don't think you can fully address child mortality if you don't look at the cooking also, the cooking problem, the smoke produced by cooking. Are you? And Claire, just a little note, I received 1 week ago an email from a lady from US who wanted to buy a solar cooker sold in South Africa for $15, saying I can't find it here for so cheap and I can't afford to pay my energy bill, and many of my neighbors are unemployed and cooking with biomass in their backyard. Are we going to extend inequality and development work to the US?
Okay, and there's better on the end, and I think this may well.
I'm very glad Richard Morgan made a crucial point, which is often forgotten, that attendance at primary school is no good unless there's some kind of guarantee of quality. And I'm afraid that the latter is not often, cannot often be guaranteed. I just wondered whether UNICEF, or indeed DFID, if they were here, could say, explain why the amount of aid spent on tertiary things like teacher training has massively shrunk in the last 25 years. I'd like to know whether this is now being reversed.
Good. Okay, yeah, this gentleman here. The gentleman here, I think, if you can make it nice and short, that would be great.
We've heard an instrumental case.
Who are you, by the way?
Matthew Richmond, sorry, from Shed Intelligence, Public Policy Consultancy. We've heard about the instrumental case and the moral case for narrowing inequality. Is there also a long-term social cohesion, social well-being case? And specifically, can developing countries learn the mistakes of wealthy countries, in the sense that there's a growing body of evidence that more unequal wealthy countries perform worse against a wide range of social indicators?
Okie dokie. Right. I've got one question for you all to finish with, which is, do we think that DFID's results-based approach is a good idea? Just keep mull over that one. Who wants to do climate change? Go on, go on.
Oh, well, the toughest questions from my friends. Thank you, Alison. It's difficult to trace causality, at least at this point. You know, this disaster or this problem happened because of climate change. What many countries, communities are clearly facing are greater climate instabilities. You know, whether it's pastoralists or urban flooding or whatever it is. I mean, just empirically, the number of natural disasters, and some of them almost invisibly taking place over long periods of time, like the greater uncertainty of rainfall. Doesn't mean that the volume is necessarily going down, but the predictability is going down, massively disrupting pastoralist life, such as in northern Kenya and the Sahel. Is this climate change? It's certainly climate change locally for those communities and putting them greater at risk. And no one agency or even set of agencies, UN or bilaterals, are going to have the answer to this. It's going to require research, innovation, and international cooperation in support of communities to adapt and to find new livelihood paths. We are extremely worried about the mega disasters that have happened. I mean, you can trace that perhaps to the Indian Ocean tsunami onwards, going through Haiti, Pakistan, and so forth, the mega natural disasters. And in a way, we're worried that we're being sort of pushed back into our original mandate as an emergency organization, because we're becoming overwhelmed by this series of natural mega disasters. So that is a huge one.
Teacher training, good idea. More quality in education, more focus on quality as well as quantity.
For sure. I mean, I can't speak to the aid issue, but I think we certainly want to hold the line and perhaps intensify our work with teachers in all respects. I mean, supportive supervision, regular and adequate pay, as well as training and so forth. The teachers have to be part of the solution, as well as schools, books, and children who are supported to learn both by the school and by their parents and communities. Okay.
Claire, I'm going to ask you in a minute to talk about cooking and social cohesion. Patrick, maybe you'd like to say one about neonatal and also talk about teacher training a bit and education. I mean, if you can just touch on those briefly.
Yep, I can do.
Unless you want to, got burn your desire to talk about any of the other ones. Time's running out. That's
neonatal delivery. I mean, I think we do actually in the report go into some detail about the importance of tackling maternal mortality in conjunction with child mortality, recognising that not just, as you say, neonatal mortality is a big share of child mortality, but as countries progress towards MDG 4, what you tend to find is that an increasing proportion of child deaths occur in the neonatal period. That's partly to do with the interventions you need to tackle neonatal mortality being more complex and structural, and in the absence of functioning health systems, it's more difficult to do that. So that connection is absolutely crucial, and the status of women and the access that women have to education and health information and the confidence that women have to place demands on health service providers are all absolutely critical if we're going to tackle that issue. And I think it is covered in some detail in the report. There's always more work that needs to be done in that area. The other area I was going to talk very briefly about was climate. But
okay, go.
Just very quickly to add to what Richard was saying, I don't think the evidence is there at the moment. We pick it up in the report, but I think that, as Richard was saying, there's this, a growing challenge of kind of slow onset and slow burn kind of natural disasters and the challenges that poses to development. And I think this is obviously likely to affect the poorest households most, for the simple reason that poor households tend to have fewer coping mechanisms for dealing with shocks. They're less resilient. And if we don't tackle household resilience, we are likely to see the bulk of the negative impacts clustering around the poorest people.
Claire, cooking and social care.
Okay, great. Well, I'm glad someone asked about cooking because it's one of my absolute pet topics. I think it's, yes, the majority of deaths in low-income countries are not caused by HIV or by malaria or by any of the things which we know about and care about and put vast amounts of money in. They are caused by respiratory disease. And the single biggest cause of respiratory disease is indoor pollution, mainly from inappropriate cooking fuels. I think this is the fact that we don't know this, that we don't campaign on this, that we don't put money on this, is a fairly grim indictment, I think, of the ways in which we measure development and the ways in which we allocate resources. For me, there are many causes of that. Part of it may be that the causes of respiratory disease are complex and in some cases difficult to treat. To my mind, another cause of it is to do with the fact that cooking is something which is almost wholly invisible to policymakers. It's women's work. It's perhaps for me it's a extremely good example of how not paying attention to gender inequalities can utterly kind of skew your analysis of the problems that we're facing, and therefore you're never going to solve them. So for me, this is an absolutely classic example of where attention to equity, kind of from the very beginnings, from your understanding of the problem right through to your sort of design of the solution, is absolutely essential. It's an example I use often, with very little effect so far, other than the fact that we're still talking about it. But I think absolutely we should keep saying that, and hopefully at some point there will be some impact. Social cohesion, yeah, I think there is a strong social cohesion case. I think clearly, I think, as I said in the presentation, I think you get better politics if you have less inequality. I think some of the evidence that is being very enthusiastically discussed around the sort of links between inequality and almost every social ill that you could care to name in OECD countries is I'm not totally convinced by all of it, to be honest, but that's another conversation. But I think clearly, and we know this both anecdotally and through much through more detailed research, inequality is bad for social cohesion, it's bad for politics, and long run it's bad for societies. Yeah.
So a quick one then. Yes, no, or don't know. Results-based approach, good idea or not?
I think it all depends on what results it is you're measuring. You can have, if it means that the only things that we care about are things that you can easily count, then it's a bad thing. If it means that we take much more effort to kind of systematically and seriously take account of the opinions of poor people, then I think it's entirely a good thing.
Okay.
That's exactly what I was going to say.
Okay, good. Okay. Patrick?
Yeah, that's kind of what I was going to say. I mean, I think the real question is what's the main driver of this? Is the main driver trying to minimise age scepticism amongst the UK public, which is important. The risk is if that completely drives your results-based framework, you can end up with some very distorted interventions. Or is it primarily about accountability for impact to the intended beneficiaries of aid programmes? And if it's the latter, then I think Save the Children will be very supportive.
Okay, watch this space in that case. Well, thank you very much indeed to my panel, to Patrick, to Richard, to Claire, to the departed Bella. Thank you to you. And hope you all enjoyed it.